Meeting is now streaming live. We are live.
Very good morning to all. Indian Naturopathy and Yoga Graduates Medical Association Maharashtra chapters welcomes you all to the webinar series on the occasion of IDY 2021. Today, we have our speaker, Dr. Pradeep Nair. His excellencies are many to explain. Professor Dr. Pradeep Nair, he is an BNYS. He also has done his MSc in clinical research and he is pursuing his PhD in health sciences. He is also worked as a professor and head of the department for the research at Sant Hriday Ram Medical College of Naturopathy and Yogic Sciences for Women at Bhopal. Dr. Pradeep Nair is also a director for Indian Academy of Scientific Writing and Research, Pune. He also holds a position of treasurer at Indian Naturopathy and Yoga Graduate Medical Association, Madhya Pradesh chapter. He also has various positions as a research consultant with MSR Arogyalayam Vijayawada, Excel Medical College, Erode, Ozone Forum of India, Mumbai, Janta Multispeciality Hospital, Calcutta, and Idatam Research, Pune. He is also a member of Institutional Ethical Committee at National Institute of Naturopathy, Ministry of Ayush, Pune. So it's great to have you, sir, with us. And today, sir is going to put a light and make us aware about fear of disease and fear of death and yogic perspective. So it's great to have you with us today, sir. And we would like to listen you more and more. Over to you.
Thank you, Dr. Pranav, and thank you for having me in here. It's a great pleasure to meet you all through this new normal virtual platform, and where we are fighting pandemic together by staying at home and staying together, though keeping distance. So today we'll be speaking on a very important topic, which is very much relevant that I feel like at this point of time where we are having a lot of uncertainties about our future. We have a lot of uncertainties about is corona is there for real, or should we vaccinate, should we do not vaccinate, and whether the virus kills us. So we have this kind of uncertainties in our mind. And if you see, India is having a very rich culture and wisdom of traditional systems of medicine, and yoga and naturopathy stays at the top of all these systems of medicine by the very virtue of that it is the only system of medicine where the humans are put in front than the medications and the treatment modalities. And most of the diseases what we see over this today's time is of psychosomatic illness, where the mind plays a larger role in the prognosis and pathogenesis of a disease. So, and if you see the entire stress or the immune system, the way it is built is more than the virus, more than the bacteria, it is our mind which is going to react and have an impact on our immune system and how our immune system behaves and offer protection to us. So I thought like, and yoga as a ancient science, close to 300, 500 years of history in India, has already described about this fact, like we are suffering about this pandemic at this point of time in the 21st century, but yoga has deliberated about this particular phenomenon of disease or particular phenomenon of death long back in 300 years through its sutras and other verses where it has been even. So I thought like it is very important rather than discussing about COVID, rather than discussing about immunity, because you have a number of videos and materials available online. I thought it is very important to discuss about what is the state of mind we are in during this pandemic, and why we are not going out, why we are not touching others, why we are not speaking to others, and why we are inside a mask and cannot identify each other. We are in a very pathetic situation. And for a generation like us who has never seen an infectious disease of this kind, it is very strange for us. And we are very panic about like, do we have to continue our life in the same way like we are doing that? So moving forward, like the fear of disease, how it is being spread. So this is a today's data, exactly the number of COVID cases in India. Like you have total number of cases reported till 2 days back is 2.86 crore. Out of that, if you see the number of recovered cases is 2.66 crores. And the number of deaths happened out of this 2.86 crore is just 3.41 lakhs. That is less than 1% of the people who had suffered or who have inflicted with this particular virus or infectious disease is being like having a mortality. But you see the larger picture, 2.66 crore of people being recovered from this particular thing is a great number. And nobody discuss about this 2.66 crore. And all are interested is in this 3.41 lakh. And why it is so? Are we a negative seeking community where we look for negative emotions or negative news always? And why we are scared about this pandemic? It is just because like we are scared of death, right? Like we don't want to die because we want to have good bank balance. We want to buy bitcoins. We want to put our money in share market and things like that. So we are worried about this 3.41 lakhs and not seeing about the positive figure of 2.66 crore. And if I am a epidemiologist or if I am a person who is building this policy, I'll be rather looking into how this 2.6 crore people have been recovered. That is very important for us to see, because staying positive is the key at this moment. Because at this point of time, WHO, ICMR, and all of us contradict our own statements. Yesterday, hydrochloroquine was good. Today, it is not good. We have been buying remdesivir for 32,000 rupees per dose, and now WHO is telling it is not good. So we are having a lot of uncertainty about the treatment measures also. And we don't know what is SpO2 level we should be getting admitted or we should not be getting admitted. So this is very uncertainty. At this point of time, the only good thing which we can have is staying positive. And how to remove this fear of disease? And is fear of disease necessary? Is it taking us anywhere? And if you see the mortality rate, like mortality is nothing but the number of people dying due to COVID. India has much more bigger problem than COVID. And if you see going with the current statistics of 3.41 lakhs of people dying, it is just 1% of the total death of COVID-19. Whereas if you see the infant mortality rate, newborn babies dying within 1 year of their birth is 2.83% in India. That is more than that of COVID mortality. And similarly, if you see 6.3% is the global mortality rate, because of there is 67 out of 1,000 infants are dying within 1 year of their birth. Aren't they the bigger problem? And why COVID is given so much importance? And if you go by mortality, is something which can happen the most, like the ultimatum of any disease is death, right? So if you go by that statistics, COVID is not a big disease at all. But the amount of fear, the amount of disease mongering which is spread by the media, the social media, the doctors, every one of us is an expert. You can see everyone, me, Dr. Pranav, every one of us coming and giving GAN to you how to save yourself from COVID-19. Where we want to save? It's 1% of people dying, and it is really sad that people are dying, but it is not a great issue as such, in the sense if you look into the infant mortality rate, and if you see the number of people dying of cancer, the number of people dying of stroke, number of people dying of diabetes complications, it is much more than the COVID. And if you see the most of the big journals, what they have published about the India's fighting on COVID-19, people are not dying because of disease per se, it is because of the infrastructure failure. We don't have beds due to the panic. The mild and moderate cases are occupying the beds, and the severe cases are not getting the beds. This is the reason why we are having more number of mortality than compared to the other diseases. And if you see the paper which is published in BMJ in around 2012, selling sickness, the pharmaceutical industry and disease mongering. So this is just like that. Disease is being sold. Disease is being marketed very well than the data which need to be marketed. 2.66 crore of people being recovered of this virus and staying happy and safe at their home. Rather than we are interested in that 1% of mortality, the people who are dying for no reason of theirs. And the selling sickness is some big mafia racket. Though we have to be skeptical about whatever information is being sent to us these days, selling sickness is really sick. And British Medical Journal, like the big journal, has already published about this particular thing. We need to take lessons from that. I want to show what media shows to us. As I have given the data of 2.66 crore people being recovered. Have you ever seen any kind of such picture, a person coming out of the hospital happily or giving an interview how he has fighted COVID very well? We don't see. We all see the incomplacency of government, people dying, people crying, people standing with oxygen cylinders, relatives being shattered. Is it going to send any positive influence to our people? Are we going to be happy by seeing such kind of pictures? Even though they are not our relatives, they are our fellow Indians. They are our fellow inhabitants of this world. This is not going to send anything positive to our community or to us per se. And if you see on the other point, there are positive images being available. You see these images where people are being recovered and coming out. The amount of positive impact it can have on our immune system. I'm not speaking in the philosophical perspective. Immune system functions by the emotions which we have, and emotions are beliefs, and beliefs are given by we doctors. Emotions are given by the healthcare providers. Why can't we give such kind of emotions where we can show that people can recover if they follow all the precautions being given by the experts, stay happy about what is happening around them, find a solace in what is given to them. We are not satisfied with what is given to us, and we don't want to put ourselves in a tight jacketed phenomenon, but we want to put ourselves in a phase that we want to see all these. Every day we watch news with so much of passion to see Arnab Goswami shouting at us, say what India is doing, how many people are dying, where is the government, where is Yogi Adityanath, where is Chief Minister of Maharashtra. We always look at such kind of sad news, and media just propagate this kind of sad news. Whereas what we require is the figures like this. Is there a positive side for COVID-19? Yes, there is a positive side for COVID-19. When you are getting infected with COVID-19, you are developing antibodies for COVID-19 by itself. That becomes your system. Your immune system is becoming so, what to say, intelligent to catch hold those memory cells and give you positive immunity against COVID-19. We are not speaking about that. We are not speaking about the possibility of herd immunity, which can be developed uh, by getting infected. And as naturopaths and yoga physicians, we always say infections are good. We always say fever is good, inflammation is good, because it gives the acquired immunity to you more than that any vaccine, more than that any antibiotics or any herbs can give to you. Infections train your mind, infections train your immune system to have the second attack. It will be preventing the second attack. And I'm very sure that most of us might have got at least one episode of cold fever during this COVID-19. Many of us don't say it out because of the scariness of the treatment regimens out, but most of us had got, even I had managed at home. So today's entire topic is not about COVID-19, but because COVID-19 is so much there in front of you, I want to start it from there. There is a positive side for COVID-19 as well, which we are not seeing, or which is not shown to us. And if you see this particular terminology which I have kept, you are sick, it is having a lot of negative repercussions on our patients being diagnosed. Like if you don't want to get diagnosed as a cancer patient, you don't want yourself to get diagnosed as diabetic or hypertensive. We all want to be healthy, right? So there is a lot of money to be made from telling healthy people they are sick. I can make a lot of money saying that your blood sugar is so high, and it's like if you are not taking this yoga therapy, or if you're not taking this particular herb, or if you're not taking sun bath, you're going to die. But what kind of prognosis I'm expecting as a doctor by giving such kind of notion to my patient? And medicalizing every normal phenomenon, like starting from baldness. Baldness is considered as a disease today, which was never a disease. It's a natural phenomenon. Getting old is considered as a disease. Getting old is a process of our life. And this disease mongering and widening the treatable illness. Like once upon a time in 1994, osteoporosis was not a disease. After 1994, WHO and ICD-10 classification suddenly decided osteoporosis to be a disease and added in the international classification of disease. And the market is expanding, and everyone is looking for an opportunity. I am not saying about only modern medical doctors, even all the Ayush physicians, including us, we all are looking for opportunities where we can sell us better. Do we need to sell our to say our people that you are sick? Likes of Ivan Lich in 1976 written this particular book called Limits to Medicine, Medical Nemesis, the expropriation of death. This is nothing but how we are selling sick very efficiently and making a large community people to feel sick. So sickness is something which is sold. Sickness is something which is very much unethical to promote. And none of us are speaking about health. We are speaking about disease. There are hundreds of hours of videos available in YouTube where people just speak about sick. sickness and disease, mucormycosis, COVID-19. Nobody speaks about how to being healthy, like what is being healthy. Disease is a part of being healthy. Like the health is a very transient phase, right? It is very ups and downs. There is no dichotomous variable for health. Like you cannot say, yes, I am healthy, no, I am not healthy. Health is a very, very, very dilute state, dilute phenomenon. Today I'm healthy, tomorrow I may not be. But being ill is a part of being well. So we should understand that phenomenon until and unless we people, like people who are watching, including our doctors, people who are watching, including our patients, you should think from your side that you should take a step how much you want to be sick and why the fear of disease is so much. Equanimity in the approach is something which is very much necessary, and Bhagavad Gita has told Samatvam Yoga Uchyate, like the equality or equanimity enables us to accept all the circumstances. Like if you see, if you get fever, if you get a diarrhea, if you get a vomiting, even if you get COVID, if you are not um, if you're not able to handle that emotions, if you're not able to handle that circumstances positively, and getting influenced by the news which you are getting will get you more sick. And this fear of sick is something which the entire community which want to make money from the other person makes money through that. And whatever is life throwing at us, and whatever is life giving at us, like these are the philosophical phenomenon which has given which were there, maybe epic, maybe true, but it is there. It is something has a really meaningful, where how to consider the pain, how to consider the joy in the same manner. No need to be excited because we are getting a lot of joy. No need to be worried that because we are getting a lot of pain. The disease is being sold to you. Disease is being each name. Like I am a physician where I don't believe in diagnosing people. Like it is my individual choice. I don't want my patient to be termed as you are diabetic, you are hypertensive. Whereas I believe in people that you are having a transient phase of delay in your vitality or a dip in your vitality, which can be empowered by adapting healthy practices. And if you say diabetes, for example, the elevation, the rise in blood sugar is just a physiological response. And even if there is some kind of fear, if there is some kind of fear of death, or if there is some kind of fear of disease, the blood sugar level is going to be up. And this physiological response will come down once your physiology is brought back to homeostasis. That is what Samatam Yoga Uchede try to promote and propagate, where try and handle every circumstances equally, not just weighing too much for disease, not weighing too much for health. Too much of obsession towards health or too much of obsession towards disease is going to make us more sick. And that is not necessary. We should be balanced in either way of that. And if you see the yogic perspective of this disease, or yogic perspective of this death, there are 5 kleshas being discussed in yogic textbooks like Patanjali Yoga Sutra. What is there? There is avidya, asmita, raga, dvesha, and abhinivesha. And it is like so beautifully explained. The first klesha, or the obstacles towards attaining, like we as a normal human being, we don't want to attain salvation, or it is not the intention for us to attain salvation or moksha, but at least have a healthy quality life. Healthy quality of life, even while we are dying, we should die happily, not looking forward to death, not thinking about death, not thinking about I do yoga because I don't want to get contracted to diabetes, cancer, or any kind of thing. That kind of negative notions. Though yoga is a positive phenomenon, we do yoga with a negative output. Do not to get a negative what is a destination. So if you see the ignorance about why this is per se, and the selfishness, like selfishness is like having belonging to everything, this ego which we have about ourselves, the attachment to things, as well as the aversion, like likes and dislikes towards things, as well as the final klesha, which is abhinivesha, which is what we are going to discuss today for another 15 minutes. These 5 kleshas are already being there. Like it is not like only that saints or sadhus should be following all these things. Ajkal, the yoga is marketed in such a way that yoga means asana, pranayama, and meditation. There is nothing beyond that. Yoga has been treated like an exercise like other. There is no difference between an exercise and yoga. Yoga is not an exercise. Yoga is meant for attaining higher consciousness levels, attaining higher levels of control over our emotions and our senses. And getting rid of these obstacles is a primary mean of moving towards the next level. If you want to become healthy, I'm not saying that disease free. Disease is a part of health. If you want to become healthy, we all want to be healthy. The ignorance is the first key. It is not like that tomorrow we will become ignorant, tomorrow we'll become non-selfish. It's not like that. It is a continuous trial and error. We will be every day, we try to become a better person. We try to become a better person in terms of detaching from what it is more attaching to us, like maybe the positions you have, maybe the money we have, or what to say, the academic excellence we want to try and achieve. We all need to have all those things, but that should not be something which is defining us. And the most prominent thing about anything is like we are scared about anything. We are scared about God. Why we go to temple? Because we don't want God to punish us for our wrong deeds, right? Why we practice healthy lifestyle practices? Because we don't want to get into any disease or any kind of early premature death. So we are scared, or we are having negative emotions about every positive emotions. Though we say that God is very much pleasing, very much positivity around the term God or the spirituality, but we go with a selfish attitude. We go with something we want not to happen to us. We want either attachment, like a lot of money. We want our likes and dislikes. I don't want to get employed under this particular person. Or we are ignorant about what we require in life. So this is the kleshas which is being described beautifully by Sage Patanjali in the terms of Patanjali Yoga Sutras in the Sadhana Pada. And if you see the death, so death is actually, if you see the cultural context of death, death has been celebrated in India. If you see in Tamil Nadu and all, even now when people die, people just dance in front of the dead body, the person, the mortal being of the person. People dance, and we have over the period of years, maybe like you say, say 100 years or so, we have become a culture, we have become a tradition averse to death. And to a medical practitioner like me, death means defeat if I'm not able to save my patient. And for most of us, death is an enemy. Like we don't want to encounter to death. And it conquers everything which you have gathered, like the position, the money, the emotions, the relationships. So we don't want to see death as a positive phenomenon. But if we see in a yogic perspective, and yogi is nothing but like nobody wearing a saffron cloth and having a long beard, take out that kind of yogi's image from your mind. Every person here is an yogi, is a sadhaka, is somebody who is trying to pursue something in life and want to achieve something in life and give something out through what you achieve from your life. And birth and death comes together. When you are born, death is certain. And maybe it is early, maybe it is late, we cannot predict that. But it is something like that. We are alive now. We harvest our life. We harvest things during the course of our life. And finally, the death also penetrates our life. And we should be ready and happy for that. In the sense, like I'm not saying that we all should die. I'm saying that when that moment comes, don't think about death like from now. Like why we are thinking too much about infectious disease, why we are thinking too much about disease per se, why we are scared about disease, and why we are not speaking about health, because we don't want to die. Let us remove that death averse culture. And if you remove that aversion towards death, you're going to live long. You're going to live long, more happily and productively than the phase where we are living with a death aversion. And every one of us, like when we get some sick patients at our home, maybe our children, maybe our parents, why we are so worried, why we are not able to give that positive affirmation to our parents or our beloved ones? Because we are becoming averse to death. It is not like that death is tomorrow, going to come tomorrow, but it is something like that we are very uncertain that these terminologies, this disease diagnostic terminologies, are associated with a lot of negative emotions. And this is what is called as abhinivesha, one of the last klesha in the path to attain salvation. Salvation in the sense having a productive quality of life. And if you see this particular sloga in Patanjali Yoga Sutra, in the Sadhana Pada, where it says about fear of death or demise exists even for those who are learned. It is not like that the common people are having the fear of death. Even advanced yogi, even an advanced person who is having so philosophical, even me, I am also averse to death. I am also having the fear to death. But eventually, we should get rid of this fear to death. And until and unless we are not going to get out of this fear of death, we are going to be troubled and haunted by this disease, the fear of disease fact, where we are always trying to accommodate ourselves and do things. We go to jogging, we go to yoga, we go to swimming with a negative emotion. And if we are getting rid of that negative emotion, so we see a lot of people like in our clinical practice, if you see people come to us like around 30, 35, does not have any history of smoking, does not, is a pure vegetarian and does yoga every day, no family history of cancer or anything, but he got contracted with cancer. How is it possible? How is it, how the medical risk factor is being a failure over there? It is just because we are doing all this by constantly thinking about not contracting this particular disease. We are having a constant fear of disease and constant fear of death. And until and unless we comes out of that, we are not going to attain the much needed wellness or health. I'm not saying about salvation, but the wellness phenomenon, the being happy even with illness. If you have cancer also, how to be happy even with cancer. And the fear is coming from our past experiences, right? And situations or past lives. Like all these fears are being inflicted in our mind. And if you see a small children, a small kid, small baby, baby does not have fear about anything. They catch snake, they catch scorpion, they go and play in mud. They are not worried about COVID-19 because we parents are worried. They are not going out, and they are not comfortable around with this mask. They are least bothered about anything in their world. That is the original vital stage which we are born with. But with experiences from parents, like for example, me as a parent put some emotions and thought process into uh, my daughter's mind, and she grows up with that kind of emotions, with that kind of fear. I'll say, if you go and touch something, you will get infection. If you go out and play in the sun, you will get tanning or sunburn. If you go out to with your friends who are not taking bath, who are playing in mud, you will be also contracting some kind of infections. Do we have any evidence based base for this? There is nothing. These all are hearsay evidences. Maybe our ancestors told us to reduce our playtime, but this nothing of this sort has any evidence that if you go out and play, you will get contracting to infection. And vaccine offer protection, antibiotics offer protection. There is nothing of evidences out of this. And all these protection, whatever we are speaking, are transient. It is temporary. The only thing which is permanent is how we are shaping our mental health, how we are shaping our livelihood, how we are shaping the future generations' attitude towards health and disease. Let us carve a generation where they speak more about health and less about death and less about this disease. Let us celebrate the optimum wellness, like what we achieve, and death is a part of wellness. Why don't we accept that part of wellness? Let us introspect. Let us face the reality. Let us face the reality that this is inevitable. Like how birth is inevitable, death is also something which is very inevitable. And why death is so painful? It is painful for all of us. Like last year, I lost my father, and I speak philosophy, but it's still painful. But I'm happy that he died. He passed away on his bed. He went to sleep. The next day, he is no more, and he was not in a single day in ICU, not in a single day with artificial ventilation or a lot of drugs being injected into his veins. He got a very peaceful salvation, I would say, in that way. It was painful during the initial days, but like I was like prolonging a person's life by giving ventilation or putting him into we don't even know whether he want to leave. You can see many patients in their deathbeds with bed sores and things like that. Is it a very happy thing for them, for somebody to uh, remove their fecal matter or remove their urine from their bed and like we are not happy to expose our naked body to anybody, right? Like only our mother would have seen our naked body, and after that we are not comfortable in exposing somebody coming and cleaning our body, doing cold water sponging. We are not able to take bath by ourselves. Death is painful just because of the reason that we have to let go everything which we believed that it has so much of importance in our life, like the money we earned, like the positions we earned, like the publications, prestige, honor, dignity in the society. These are the things which makes death so painful, and we think this is our identity. And what is our identity? It is, these are the things which are acquired, like our immunity, and the fear is going to be the root cause for every pain, and it is virtually incurable. And if you see why people are not responding to any treatments, many people respond to COVID-19 treatments whatever is being given. Many people respond even without any treatments. Why there is a difference? Because the perceptions about a disease, the perception about recovery, the perception about you yourself, like how you handle a circumstance, how anonymously you are handling your circumstances, does matter about the percentage of recovery for you. And if you are a person who are scared about being deceased, if you are a person who are scared about death, it is virtually incurable. We cannot cure such a kind of person. It is an affliction. It is something which is being installed in our body, and we are carrying that as an emotion. Let us try and get out of that, like, and let us speak more about this. Let us speak more often about this. Let us speak more about health. Let us speak about how a positive death can be achieved, like not today, how a positive aging can be achieved. And the yogic perspective which I want to say is, like, the goal of yoga is not bending and doing asanas. The goal of yoga is not doing pranayamas like this in the front of TV, and not doing Kapalbhati 100 strokes at a time. The goal of yoga is to attain freedom from such kind of infliction. That is why the 8 steps of yoga which is being given, it does not start with asana. It starts with ahimsa. It starts with non-violence. It starts with non-violence towards your thoughts. It starts with non-violence towards others and to yourself. And let us get rid of this fear. If you see the toddlers, if something is scary, they'll close their eyes like this. Like they see that nobody is looking at them when they close their eyes. That's the best attitude you can have. Just ignore everything around you. Just look into you. And if you are a person with a fear of death and you die every day, it is not like that you die only once in your life. Every day we are dying. Every day we are dying because of that fear which is being inflicted in our mind. And yoga is something which trying to get rid of this perspective. And next time when you speak to your patient as a yoga naturopathy physician, or when you speak to a yoga naturopathy physician as a patient or a health seeker, you discuss about these facts, how to get rid of this through the noble uh, practice of yoga, which has more thing to do than asana, pranayama, and you say the meditation. And if you, the final slide or the departing slide I want to give to you all is something like the quality versus quantity. Do we need to have a quality of life or quantity of life? Do you want to live 100 years? In that 40 years you are spending on a bed with bed sores, somebody coming and doing things for you where you are not able to do something for yourself? Or you want to have a quality of life, live a life fullest to the fullest sense? So what kind of life we want to choose? It is very individualistic, and this perspective is something which takes time to sink in. But the kind of what to say, the disease selling or sick selling which is happening, I feel like this is the attitude which we all should develop. And it is not a newer perspective. It is already there in our scriptures, and we are very proud of our scriptures and philosophies. And this is something which we need to adapt. And this can save a lot of time. This can save a lot of mental agony and a lot of money which we all want to earn. And thank you for the opportunity in ICMA Maharashtra. And I hope I have not taken much time, and we will connect on this, and there will be larger audience in future, and we can come with a lot of larger perspective on this particular thing. And there are a lot of experts out there who can speak on this as well. Okay. Thank you, Dr. Pranav.
Thank you, sir. That was really an eye-opening and breathtaking talk. That's really inspired us to think on a new dimensions, that what a disease can give a mental one kind of a stress, or how it acts on physiology. So there is one question, sir, which I have received from one of our viewer. She means to say, is being ignorant about the disease and condition is okay? When if more the we are knowing it, more the we are watching TV, so as that causing us more fear, or sometimes being ignorant is okay to not to get fear?
No, being informed and being ignorant is two different things. Like where it is good to being informed if you are in a very good mental capacity to handle that. That is what I said, samatva muchyate. Like whether when we say that you are having diabetes, or how you are going to handle that particular feeling, because diabetes is something which is third as it is lifelong, right? So I don't want you to be ignorant. Like if I like, there is something called diagnosis versus prognosis. If your prognosis is more important, it is okay not to say about the disease, because prognosis is what we want to achieve. What we are trying to achieve, that by naming a person, you are a cancer patient. There is nothing. It is going to inflict more fear. Whereas working with him, that there is some kind of delineation from the normal phenomenon, but we can work together to bring that to track. That will have more positive impact. And this, all these names of the disease, whether it is benign or malignant, whatever names of the disease, is very misleading, and it is very violent, right? Like how many happy cancer patients we have seen? None. All are looking towards death. That is because the affliction towards death is associated with this particular term. So let us put the prognosis in front rather than the diagnosis. Diagnosis is good for you because you are good with Hutchinson's, Davidson's, it's fine. But what is that patient has to do with that particular terminology? It is going to make him more sick than bringing him towards recovery.
Very true. Very true, sir. Thank you, sir. Thank you very much. It was really great to have you with us, and I believe people to learn something new at each time when we meet you, and when we are going to meet our esteemed speakers who are we are going to invite for the Enigma Maharashtra as a speaker. Thank you, sir. Thank you for your valuable time. Behalf of Enigma Maharashtra, we thank for your valuable time given to us. Wish you a good day, sir. Thank you.